First and foremost, I'd like to invite Dr. Samuel, our Chesterfield Health District Director, to come forward and share an update on the coronavirus, also known as COVID-19.
Madam Chair, members of the board, I'm Dr. Alex Samuel. I'm the Health Director for the Chesterfield Health District, which provides public health services to the residents of Chesterfield County, Powhatan County, and the city of Colonial Heights. I appreciate this time you've given me to provide you with an update on the current coronavirus situation. Public health officials are referring to the disease caused by the coronavirus as coronavirus disease 2019, or COVID-19. So coronaviruses are a broad category of viruses known to infect humans. Four are known to cause the common cold. However, this category includes some additional viruses that are implicated in more serious respiratory infections, including the SARS-CoV. CoV stands for coronavirus, which was identified in 2003. SARS stands for sudden acute respiratory syndrome, as well as the MERS-CoV identified in 2013. That's a Middle East respiratory syndrome. The virus I'm going to talk about today is the SARS-CoV-2, which was identified in 2019. This, of course, is implicated in the cause of coronavirus disease, or COVID-19. And it was first identified in Wuhan, China, very recently, December of last year. So what do all three of these viruses have in common? One of which is that they infect the respiratory system and cause respiratory disease. And all three have jumped species, which means that they originate from animal sources, but have mutated and can now infect humans. So a little bit of background in terms of what we know about COVID-19. Certainly this is a new novel virus, so information is still catching up. But what we do know so far, a lot of which comes from experience in China, is that exposure to the virus comes primarily from close contact with individuals who are sick. And this is by respiratory droplets. Respiratory droplets are basically produced when an individual who is sick coughs or sneezes. Somebody contracts the virus by inhaling or getting those respiratory droplets on a mucous membrane, like eyes, nose, and mouth. That's the primary means of contracting COVID-19. Another way is touching your eyes, nose, or mouth after touching a contaminated surface. Symptoms of this virus typically include fever, cough, shortness of breath. Again, this is primarily a respiratory disease, so cough and shortness of breath often accompany this particular infection. In terms of the course of illness or how it affects individuals, again, this information is primarily from data coming out of China, both from Chinese officials as well as studies done by the World Health Organization. For most individuals who contracted COVID-19, the course of disease is mild. About 80% of individuals have mild disease outcomes. For children, individuals under the age of 19, again, very mild outcomes. In fact, very few have actually shown evidence of having the disease. For about 1 out of 5, or 20% of the individuals, however, who contracted COVID-19, hospitalization typically is required. A smaller subset of those individuals fall into two categories of greater risk. Those are individuals over the age of 60, particularly those who are over the age of, or 80 years and older. Those are patients who have shown greater risk of succumbing to COVID-19. And then the other category of major risk are individuals with underlying chronic medical conditions. Heart disease is noted as the most common. Certainly high blood pressure, diabetes, and lung disease are also listed. So I think it's important to talk a little bit about how easily COVID-19 spreads and what the risk of death or serious outcome is from contracting it. And probably the best way of answering these questions or offering this information is to compare COVID-19 virus with some other viruses. So looking at the slide, there's a lot of information presented there, so I just want to focus on a few comparisons to illustrate my points. But first, it's a good idea to define a few things, one of which is the term 0 or R naught, which you'll notice there in the middle column. And this is basically a measure of how easily the virus is spread. It's an estimate of how many people one sick person can infect. The other term I'd like to highlight or define is that which is indicated as CFR. CFR stands for case fatality ratio, which is listed in the column on the far right. The case fatality ratio is a measure of how many people die who become ill after contracting the virus. So comparing a few different viruses listed, I won't go through the whole list. For MERS-CoV, Middle Eastern Respiratory Syndrome virus, listed on the top row, the rate of spread, or R naught, is pretty low. One infected person typically spreads it to one other person. It has, however, as you'll notice, a very high case fatality ratio of 34%, which indicates about 34% of individuals who contract it fall ill and ultimately die. For seasonal flu, which is listed on the second row there, one person can spread it to roughly 1 to 2 other people. And about 0.1% of individuals who get the flu die from it. Again, these are typically older and more medically fragile individuals. Now looking at coronavirus, the coronavirus that causes COVID-19, which is listed on the fourth row. Again, we're using data that's currently available from China, so we're still learning. In terms of infectability, it's estimated that one person can infect between 1.4 to 3.9 other individuals. However, the number seems to be settling around 2.5 individuals who are infected by one individual. And in China, again, close to 2% of the individuals who became ill from the virus died from it. These were primarily individuals who were older and, as I mentioned earlier, had chronic health conditions. So, right now, how many people are sick? This table, the data on this table was taken from a number of different sources earlier today, including Johns Hopkins, as well as the Centers for Disease Control and Prevention, as well as the Virginia Department of Health. So in terms of worldwide totals, there are, or were, 121,564 cases with 4,373 deaths. In China, there were 80,969 cases with 3,162 deaths. So obviously most of the cases as well as deaths are in China. I will point out that in China, the number of cases has dropped significantly over the past 2 weeks or so. In the United States, again, as of this morning, per CDC report, there were 987 cases and 29 deaths. In Virginia, there were 9 cases. 1 new case was reported in the central region. So, talk a little bit about response. So how is the United States responding? I've listed a number of kind of major approaches or interventions that are ongoing right now. One of which is the CDC travel advisories and warnings based on level of risk from countries where we are seeing wider spread or widespread incidence of this disease. A lab test was developed and it is currently being deployed. Commercial labs now have access to it and are beginning to use it for testing. There is an antiviral clinical trial underway to help individuals who get infected overcome the disease. There is a vaccine currently under development here, both in the United States as well as in other places around the world. One of the big things that the CDC offers is information and guidance to the general public, medical community, public health agencies. And then finally, there is funding being allocated by the federal government to address this issue. So in terms of how the State Health Department or Virginia Department of Health is responding, it activated very early in this situation their incident command structure to coordinate the public health response. They are working very closely with clinical providers as well as the CDC to reduce the spread by finding individuals who are positive, isolating them, and preventing spread that way. They are monitoring patients who are tested for the virus, and then they are identifying close contacts of individuals who could potentially have the virus. So in terms of a regional approach, very recently there's been a coordinated effort among localities, those that are listed there, Chesterfield, Hanover, Henrico, and Richmond City, to address this issue by bringing together resources, personnel, and essentially minds to handle this issue quickly and effectively. So very recently, this group has met twice, met again once this afternoon, is establish a unified command and incident management team, looking at a wide range of facets to address it. Some of the key objectives include a coordinated public information approach, logistical support to hospitals and healthcare facilities, as well as a plan for continuity of services. So at the local level, it's important to talk a bit about how we at the Chesterfield Health Department are responding, Health District are responding. So we too, following suit with the state, we have established our incident management team to coordinate response planning. We are providing awareness and updates to the medical community, schools, other community partners, and the public in general. We are also conducting surveillance and investigation activities for any potential suspects of suspected cases. And then we are identifying all at-risk travelers returning from countries with entry restrictions. And so far, those are formally China and Iran, and supervising self-monitoring of individuals who are returning from those countries. So given that there is no vaccine, one of the main approaches that has been tried in China, as well as what is being promoted here domestically, are non-pharmaceutical interventions, or NPIs. There are basically three categories of NPIs, one of which is personal NPIs, and this is simply doing things that one can do to prevent getting the virus yourself or spreading to another individual. Another category are community-level NPIs, and there is brand new guidance that came out from the CDC. As a matter of fact, it came out today, aimed at scaled measures to prevent the spread based on local levels of transmission. These are being called community mitigation strategies. So the scales currently include none, meaning no virus presently spreading in your community, minimal to moderate, and substantial. And so included in these scaled approaches are fairly specific guidance for a number of different entities, starting at the household level, schools, nursing homes, workplaces, community and faith-based organizations, and healthcare facilities to plan interventions to again address the spread of the virus. And then the final non-pharmaceutical intervention that I'll mention are environmental NPIs, which again is simply surface cleaning measures to prevent the spread of respiratory viruses. So I'll kind of beat the drum that I trust most of us have heard already, and this is simply a reiteration of the personal NPI that I mentioned earlier. So these are things, very low-tech things that all of us can do. Some of it will mean changing behaviors that are long-standing habits that we have, but simple things like washing your hands with soap and water frequently for at least 20 seconds, or using hand sanitizer if you don't have access to water. Avoiding close contact with individuals who are sick, avoiding touching your eyes, nose, and mouth, which understandably is difficult to do. Staying home when you're sick, covering your cough or sneeze with a tissue, and then cleaning, disinfecting commonly touched surfaces at home or work. So, coming towards my conclusion, some critical take-home messages are that this is a rapidly evolving situation, and given how quickly things are happening, we should expect changes in guidance as we learn how to more effectively address the transmission of this virus. We are looking at multi-layered and multifaceted responses at the state, regional, and local levels. There are commitments to address this at each of those levels. And I think another thing that's important to point out, that currently influenza, the seasonal flu, is the most important public health threat in the country. So it's never too late. It's not too late currently, certainly, to get your flu shot. the last thing is that updates, at least from the state level, are offered very routinely at the Virginia Department of Health coronavirus website listed there. So in conclusion, there is certainly a lot of misinformation being spread about the coronavirus. It's important that people go to reliable science-based sources for information. The Virginia Department of Health, as I mentioned earlier, and the CDC websites provide information for individuals, workplaces, community organizations, healthcare organizations, and the community at large to help prepare and respond. So I'm happy to take your questions.
Well, thank you, Dr. Samuel. It was referenced earlier, the region is trying to work together. It always gets confusing when one locality has statements that are different than another locality amongst the big four. So we're trying to be mindful and trying to work with all our counterparts and have the same messaging. There's many people in the audience that are part of this collective team that meets regularly, if not daily, on this topic. We as a county right now, there are no mandates, if you will, from the State Health Department or CDC for Chesterfield County, nor this region that I'm aware of. So any events or any changes of events or notices that are being issued really by a locality or perhaps the region in advance of what might be a directive. But currently right now Chesterfield County has, as the county government, has not taken any notices beyond what has been recommended by the State Health Department and CDC. Having said that, we are going to be as mindful as possible. We're an engaging body as far as meetings. We're going to be having community budget meetings for the next week or so. We respect the fact, and I repeat, respect the fact that there are some people who may not want to go to such meetings, who want to learn about Chesterfield County, who want to offer comments, if you will, about our budget. We are planning to try and do some social media, Facebook Live, videos of what those meetings otherwise are, and push them out to the public for them to comment on the budget. We're also actually trying to brainstorm and respect the fact that a large meeting room like this that can get filled for public hearings on a wide range of topics, that there are people who are elderly, at risk with immune systems, disabled, and it may actually be something we use as a model going forward for people who have logistical constraints in getting to a meeting to offer a public hearing comment. And we're just trying to, again, brainstorm and be wise and practical for how people can stay engaged with their county and offer comments as if they were here. So more to come on all those topics. And I thank Dr. Samuel. He is a true leader on this topic, a rational and thoughtful leader who's trying to protect the people, trying to protect the workforces, trying to protect the visitors that come here. Thank you.
Thank you very much.
Thank you, Dr. Samuel.